Good morning. Welcome to the breakfast show this morning on EAVA FM. We've got a really important show this morning, and it's all about mental health. So really, there's a consultation that's been run currently by the NHS, wanting to find out from the communities on what services that we have currently and how can future services be developed to meet the needs of the communities. I'm glad to say that we've got colleagues from the NHS today. So I've got Sue Venables, who also, we've got Zara, who will be sharing some of the services that are currently operated by Leicester Partnership Mental Health Trust. And I'm also glad to see that we've got somebody from the community, Shilpa and Meeta, who are going to be sharing obviously some of their experiences. So it's great. We've got a really good audience today, and really want to get the listeners to kind of ring in and share your experiences and what you'd like to see in the future. આજે છે ને અમે માનસિકની બીમારીની વાત કરવાના છે. અહીંયા અત્યારે NHS એ કોન્સલ્ટેશન ચાલુ કર્યું છે કે આપણા કમ્યુનિટીને કઈ સર્વિસીસ હોવી જોઈએ અને અત્યારે કઈ છે આપણે કમ્યુનિટી માટે. તો એ લોકો આજે કોલિગ્સ આવ્યા છે NHS માંથી, એ લોકો કહેશે થોડુંક કે કઈ સર્વિસીસ છે ને કોન્સલ્ટેશનમાં શું કરતા છે ને શું જાણવું છે. ત્યાર પછી આપણે બે આપણા કમ્યુનિટીમાંથી આવ્યા છે બહેનો, એક શિલ્પ કરીને અને એક મીતા કરીને. એ લોકો બી તમને આપણને કહેશે કે એ લોકોની એક્સપિરિયન્સીસ શું છે. તો સાંભળજો ને આપણે દિનેશભાઈને થોડુંક હિન્દીમાં થોડુંક કહેશે તમને આપણા શો કેવું છે આજે.
हाँ श्रोता मित्र नमस्ते. आज हम आपके लिए एक बहुत ही महत्वपूर्ण विषय लेकर आपके सामने प्रस्तुत हुए. वो है मानसिक स्वास्थ्य के बारे में. आज हम मीता, ज़ारा, शिल्पा, मीना, NHS और जो कम्युनिटी में जो लोग काम कर रहे हैं, उनसे हम सुनेंगे कि मानसिक स्वास्थ्य के बारे में हमें कौन सी सेवाएं उपलब्ध है, और जो भी ये का नया कंसल्टेशन विचार विमर्श शुरू किया गया है, उसमें कई नई सेवाएं शुरू करने की सोच या प्रस्ताव किया जा रहा है. तो उसके बारे में हम आपके लिए बहुत ही महत्वपूर्ण जानकारी लेकर यहाँ उपस्थित हुए हैं.
ચાલો હવે આપણે બધા ગેસ્ટને લઈ આવશું. આપણે પહેલા સુને લઈ આવશું live on air. Good morning, Sue. Can you hear us?
Morning. Yes, I can. Hi, good to see you again.
Good to see you. Would you like to introduce yourself to all our listeners?
Yes, I'm Sue Venables. I'm heading up this current consultation, but I'm the head of engagement and insights for an NHS organisation. It's called the Clinical Commissioning Group, and the organisation just basically buys or we call it commissions health services for people not only in Leicester but also for Leicestershire and Rutland as well.
Okay. Dinesh bhai, do you just want to mention that?
धन्यवाद. सु वेनेबल को धन्यवाद देते हुए आज आपको उनका परिचय करवाते हैं कि वे ये जो विचार विमर्श, ये जो कंसल्टेशन चल रहा है, उनकी उसका नेतृत्व सु वेनेबल ने लिया है, और वे एंगेजमेंट और इंसाइट का भी नेतृत्व कर रहे हैं.
Okay, Dinesh, Kirit bhai, બોલવું છે કઈ?
આ તો ખાલી સુએજ જે ઇન્ટ્રોડ્યુસ કર્યું છે કે NHS માંથી આવ્યા છે ને અત્યારે આ કોન્સલ્ટેશનનું મેઇન રિસ્પોન્સિબલ છે એના માટે. એટલે આજે સ્ટુડિયોમાં આવ્યા છે ને આપણે પહેલો ક્વેશ્ચન સુને પૂછવાના છે.
આપણે બીજા કોઈ ગેસ્ટને લઈ આવવાના છે પહેલા?
આપણે છે ને શિલ્પને છે ને 8:40 જવું છે કામે, એટલે આપણે એ ટાઈમ સાચો છો. પણ પેલા સુને આપણે કહેશું, પૂછશું કે કઈ આ કોન્સલ્ટેશન સાનું કરતા છે.
Okay, so Sue, what is this consultation about, and how is it set up? Do you want to give us a little what services and are the consultation on?
Yeah, there's it's quite a big consultation in the amount of things that we're talking to people about, but they come really into two main areas. So one main area is if somebody's got an urgent need and need mental health support quickly, we've got a whole pocket of improvements that we're making to make sure that people can get access easily in different ways, and also in a really timely way. So there's a big pocket of stuff there. Then the other big area of improvements that we're making is around services in providing them closer to where people live. So about getting more facilities, more services, more staff working in local areas and in local communities. So they really come in those two big groups. Just to give you one or two examples. So about the urgent stuff, we introduced it in COVID, a new central access point. And basically it's a telephone number that people can ring to get quickly assessed and then diverted in the right service that suits them. So that's one big improvement. Another example is currently we have 3 drop-in centres almost. We call them crisis cafes, or sometimes they're called wellbeing centres, or they do have other names in the community. And those crisis cafes, we want to have 25 of them. So that will be a big increase. And basically, this consultation is asking people, where do you want them? And what do you want to see in them? So lots of improvements that we're making around a whole range of services.
Thank you, Sue, for giving an explanation. We're going to get just Dinesh Bhai to have explain in Hindi what you've just said in terms of the consultation.
धन्यवाद किरीट भाई. अभी हमें सुवेनेबल ने बताया कि यह कंसल्टेशन या विचार विमर्श क्यों कर रहे हैं. तो उसमें बहुत सारी चीजें देख रहे हैं, किंतु उसमें 2 चीजें बहुत ही महत्वपूर्ण हैं. कि मान लीजिए आपको कोई शीघ्र ही कोई जरूरत हो, शीघ्र ही आपको कुछ सहारा सपोर्ट की जरूरत हो, तो उसके लिए आपको वो सहारा, आपको जो भी जरूरत है वो पूरी करने के लिए जो सेवा है वो आप बहुत ही सहज रूप से, बहुत ही इजीली आप उसे पा सके. उसके लिए बहुत सारी डिफरेंट तरह की चैनल, यानी टेलीफोन या आपसी और जो भी सेवाएं आपको चाहिए वो आपको समय से मिल जाए. यह एक दूसरा है कि जो सेवाएं दी रही है वो सेवाएं आप जहां रह रहे हो उसी इलाके में आपके नजदीक आपको उपलब्ध की जाएंगी. उसमें सेवाएं होगी, तरह तरह के स्टाफ होंगे, और जैसे अभी कोविड में हुआ, जैसे आपने देखा कि कभी भी कोई भी समस्या हो तो उसके लिए एक बहुत ही शीघ्रता से हो रहा असेसमेंट आपके लिए उपलब्ध होगा. और दूसरी एक बात ये कि समाज में इसे कहा जाता है ट्रायज काफे या वेलबींग सेंटर या क्राइसिस काफे. तो उसके बारे में आप क्या चाहते हैं और आप किस तरह चाहते हैं, उसी के लिए आपको यह पूछा गया है. इसीलिए यह विचार विमर्श है.
થોડુંક ગુજરાતીમાં સમજાવશો કે શું એ અત્યારે છે ને સર્વિસીસ જે એ લોકો કન્સલ્ટેશન ચાલુ કરતા છે એ છે ને ટૂંકમાં બે કરતા છે. એક છે કે અર્જન્ટ જ્યારે જરૂર પડે માણસની કઈ બી સર્વિસીસ એ અત્યારે છે ને સેન્ટ્રલ એક્સેસ પોઈન્ટ તરીકે ટેલિફોન સર્વિસ ચાલુ કર્યું છે ને એ લોકો એનું બી આપણે વાત કરતા છે કે તમને જરૂર પડે તો એ ફોન નંબરથી તમારાથી કોલ કરાય ને પછી તમને મદદ મળશે. ને બીજું કે આપણી ક્રાઇસિસ કેફે અત્યારે 3 છે લેસ્ટરશરમાં, પણ એ લોકોને વધારે 25 વધારે ખોલવું છે ક્રાઇસિસ કેફેની તો વેલબિંગ સેન્ટર્સ ને એની બી જાણવું છે કે આવવું જોઈએ આ બધા સેન્ટર્સ કે કેફેઝ. તો એ છે ને મેઇન તો એ આ વાત કરતા છે. Okay, I'm just going to ask Meeta to just share from what you've heard from Sue. If you could just share your experiences, obviously as somebody who's been a carer as well. So would you be able to? I'm going to bring Meeta in. Sorry, Meeta in to share just what she's heard really in terms of the current services.
Hi, Kirit. Can you hear me? Okay.
Yes.
We can't see you, Meeta.
Yeah, I'm just keeping my camera off. If that's
Okay.
all right. Yeah.
Yeah, that's fine.
Basically, I rang my son, who's 30 years old, has got severe depression, and I was really desperately looking for help because he didn't realize that he actually has a mental illness. And so I rang that central number, and they basically said to me that unless he consented, they couldn't get any help. They couldn't help me. He had to consent. So when you've got somebody with a mental illness who doesn't have insight into the fact that they are ill, it's really difficult. And that was a frustration. So then I went to the our GP, and the practice manager basically turned me away, said, is he drinking? Is he eating? And I went, yes. And basically she turned me away because she can't help.
Thank you for sharing that, and obviously sorry to hear the challenges you've had in terms of accessing support. Dinesh bhai, just quickly in Hindi, just explain what Meeta has just said.
अच्छा, मीता जी को धन्यवाद देते हुए अभी मीता जी ने उनका निजी अनुभव प्रदर्शित किया कि अपने परिवार में किसी को मानसिक स्वास्थ्य के बारे में कुछ जो समस्या खड़ी हुई, एक अवसाद जैसी, उसके लिए उन्होंने जो मदद के लिए इधर उधर दौड़ना पड़ा, उसके बारे में मीता जी ने कहा कि उनको बहुत ही शीघ्रता से सहायता की जरूरत थी, क्योंकि जो परिवार जन को यह समस्या थी उसे पता नहीं था कि उसे कुछ मानसिक अस्वास्थ्य की समस्या है. मीता जी उन्होंने कई जगह यह सहायता के लिए मांग की, किंतु कहीं से भी उनको जो सहायता की जरूरत थी वो मिल नहीं सकी. जनरल प्रैक्टिशनर के पास जाने पर जैसे हमें हर एक बीमारी के लिए जो कॉमन छोटे छोटे जो प्रश्न पूछे जाते हैं वे प्रश्न पूछकर उनको घर वापस भेजा गया. तो इस तरह से जहां मानसिक स्वास्थ्य के लिए बहुत ही शीघ्रता से सहायता की जरूरत थी, वह उन्हें मिल नहीं पाई.
Also, I think it's. I'm going to bring in Shilpa just to kind of again share her experiences of trying to access services. So, Shilpa, were you with us? And again, you're happy to keep your camera off. That's not a problem. Shilpa.
Shilpa. Hi, Shilpa. Can you hear us? Somebody, Shilpa.
Okay, well, while we're waiting, Sue, just and sorry, we've got Zara as well. So welcome.
Would you like to introduce yourself, Zara?
So my name's Zara. I'm the ward sister at the Bradgate Mental Health Unit. So nice to meet you all.
Okay, nice to meet you too. What part of the consultation are you, the Bradgate unit? Do you want to say a little bit about the Bradgate Park unit? Unit?
The Bradgate Mental Health Unit's an inpatient hospital for patients suffering from a mental disorder. So my understanding of the consultation is that we want to improve access of services in the community to prevent people from coming into hospital, because we appreciate that access to services is often a criticism that, as the speaker that's just said before, we don't know, family members often don't know where to go to ask for help. So building that community support and getting patients access to support in the community to prevent hospital admission.
Okay. Kirit bhai, do you want to explain that in Gujarati, please?
Okay, so Zara kid che loko apri Bradgate unit chair apri hospital ma NHS loko main ke jene jaru support jo hai ne jo hospital ma jo jai to loko madad kare loko ni je mansik ni je bimari hoy loko support kare ne loko ti bina under loko na bada consultants hai loko support kare ne pachi madad kare e ta kaam karta hai.
Okay, we've got Shilpa here. Shilpa, can you hear us? Somebody? Hello? Shilpa? No, nothing. Okay, we're going to be moving on now. I'm going to take it back to Sue for the next question. So will any services be shutting down in terms of after the consultation is done? Are you planning to shut down any services or shut down or remove any beds from the NHS in terms of this whole project out there?
No, it is interesting with the consultation, isn't it? Because very often people do think that the NHS is making a change, and very often, you know, sadly, those changes do sometimes mean the closure of buildings and everything like that. But the great news about this consultation and this whole set of improvements is that it's investment in mental health. We know, and you know, listening to Mita as well and other experiences, we know that mental health services have not received either the recognition that they've needed over the last few years, but also the investment. We know that obviously physical health conditions, are invested in. I mean, always more is needed, but it's never had that parity, that equal status with physical health. So there is additional investment in terms of improving services, and that is great news. And that will mean additional staff investment. It will also mean, though, a bit of rearrangement of current staff and the way that they work, because we know that there's quite a lot of duplication and triplication of services, and if people and teams are working together much closer, then what patients will hopefully receive in terms of services is they won't be handed from one service to another, which is really frustrating, because you end up telling your story over again to many people, and you feel you're still not getting any further with it. If a handover...
Just want to remind you, we've got 30 seconds. Sorry to interrupt you. We've got 30 seconds before we go into our commercials at 8:30. So if you just want to kind of finish off, you've got literally 20 seconds, Sue.
Yeah, so I mean, just very briefly, so that will end, and if people are transferred from one service to another, then their care notes will go with them, and people will know who's sitting in front of them and what the problem is.
Fantastic. Okay, we're going apre commercial break ma jawana che apre avsu 3 minute ma avsu pachi apre pacha avsu EAVA FM.
EAVA, sharing the richness of cultures. This is EAVA FM.
Grill Shack, Leicester's finest jerk chicken specialist, giving you that carnival taste all year round. Jerk chicken, rice and peas, coleslaw and fried dumplings. Yummy. Come and check us out in the heart of the city, 167 Belgrave Gate, Leicester, LE1 3HS. Try our boneless jerk range in a wrap, gourmet burger, pitta or strips. What we do in our jerk range, we also do in peri-peri. Online delivery via Just Eat, Deliveroo, I'll Get It and Zoom. For collection and orders, call us on 0116 262 2885. That's 0116 262 2885. Grill Shack, the authentic taste that brings a smile to your face every time.
Serving the community 24 hours a day. EAVA FM.
1 in 4 adults are unwell with their mental health each year. We want to invest in and improve mental health services for adults in Leicester, Leicestershire and Rutland to make care easy to access, with health services working together to support people's individual needs. Whether you use services now or may in the future, tell us what matters most to you and your family by sharing your views in a consultation. Complete a survey at www.greatmentalhealthllr.nhs.uk or call 0116 295 0750. And together we can make the change. Step up to great mental health today.
The voice of Leicester, sharing the richness of cultures. This is EAVA FM.
हर साल 4 वयस्कों में से एक मानसिक रूप से अस्वस्थ होता है। हम लेस्टर, लेस्टरशायर और रटलैंड में वयस्कों के लिए मानसिक स्वास्थ्य सेवाओं में निवेश और सुधार करना चाहते हैं, ताकि लोगों की व्यक्तिगत जरूरतों का समर्थन करने के लिए स्वास्थ्य सेवाओं के साथ मिलकर काम करना आसान हो सके। चाहे आप अभी या भविष्य में इन सेवाओं का उपयोग करें। परामर्श में अपने विचार साझा करके हमें बताएं कि आपके और आपके परिवार के लिए सबसे महत्वपूर्ण क्या है। www.greatmentalhealthllr.nhs.uk पर जाकर एक सर्वेक्षण पूरा करें या 011629500750 पर कॉल करें और हम सब मिलकर बदलाव कर सकते हैं। आज ही ग्रेट मेंटल हेल्थ की ओर कदम बढ़ाएं।
EAVA FM.
Everyone can now get free rapid COVID-19 tests twice a week. They show your results within 30 minutes. They also show you're doing what you can to protect your loved ones, your friends, your workmates, and that you want to keep life moving again. Around 1 in 3 people who have COVID-19 have no symptoms and are spreading it without knowing. That could be a friend, a relative, a workmate. It could even be you. Rapid tests are easy to get from nhs.uk/get tested. Let's take this next step safely.
EAVA FM is a multilingual radio station serving the diverse communities of Leicester on 102.5 FM. For advertising and sponsorship, email sales@eavafm.com or call 07811 659 364. That's 07811 659 364. Serving the community, 102.5 EAVA FM.
We're back live on EAVA FM, and we're also live on our Facebook, and we're also live on our YouTube. I'm guessing everyone, this is a breakfast show, so everyone's probably tuned in right now. Thank you for the messages, thank you for the phone calls, the WhatsApp messages as well coming through. Okay, so we're going to be talking in Hindi now, so we're going to move on to Dinesh bhai.
हाँ, अभी हमने सुवेनेबल को सुना कि लोगों को ऐसा लगता है कि कभी भी कंसल्टेशन या विचार विमर्श किए जाते हैं, तब जो ट्रीटमेंट के लिए जो बेड से वे कम हो जाएंगे, सेवाएं कम हो जाएगी, ऐसा संदेह लोगों के मन में होता है। किंतु सुने कहा है कि ऐसा नहीं होने वाला है। कोई भी कुछ भी बंद नहीं होने वाला है, पर क्या होने वाला है कि धनराशि जो इसके पीछे जो हम खर्च कर रहे हैं, वो धनराशि बढ़ेगी। अभी तक क्या हुआ है कि जो मान लीजिए कि हमें जो शारीरिक रोग होते हैं वो सभी जान सकते हैं, किंतु मानसिक स्वास्थ्य को, मानसिक बीमारी को ज्यादा मान्यता नहीं मिल पाई, इसलिए उसमें धनराशि भी कम गई। तो अब क्या हो रहा है कि ज्यादा पैसा उसमें डालकर स्टाफ बढ़ाया जाएगा, स्टाफ आपस में अच्छी तरह काम करेंगे और आपको स्वयं अनुभव होगा कि आपको एक जगह से दूसरी जगह दौड़ते नहीं जाना पड़े और आप जहां भी चाहेंगे आपकी जो सारवार की जो नोट्स है वो आपके साथ जाएंगी ताकि आपको अपनी एक ही सवाल के जवाब बार बार देना पड़े। तो यह हमने सुवेनेबल ने अभी बताया कि ये कंसल्टेशन से हम क्या पाना चाहते हैं।
Okay, so we're going to move on to our third question. Really, the question is, Sue, why do we need to make the changes that you're proposing in the consultation, and what do you hope to achieve?
Really, we before we started the consultation, we'd been talking to service users and patients people who might use the service in the future to understand really what mattered most to them. And some of the things that they said was that they want an easy way to make contact with somebody who's going to give them mental health support. They find it very confusing. And very often they see that there is only one place available to them, and that is the A&E department. And, you know, we know that A&E is not the right place for people who need mental health support. So that's one of the reasons. We also know that sadly we've got some long waiting times, particularly for therapy services. So we needed to solve that issue and that problem. We also know that in hospital, if people are in a physical health bed and they require also mental health support, perhaps due to their physical illness, it also takes a long time to get that support. So this consultation actually sees people both in the A&E department, if people do find themselves there, but also within the hospital to support people. As I said earlier, people were also very frustrated that they were passed from one service to another. Their notes, the information that they provided very often didn't go with them, or they just ended up repeating the issues. And that's very frustrating. I mean, it's very frustrating for anybody, but particularly if you are desperate to receive support. And basically just people want to reach their own individual goals. They want to get back to the person that they once were. They want to be able to live independently. They don't want to have to rely on other people. And people also said to us that to have things central, it doesn't all really make sense to them. You know, as with any services, you know, not all people have good access. A lot of people don't drive. You know, they're reliant on public transport systems. They're reliant on other people. So it really made sense to them to have either care closer to home within their own community environment, or within their own home, if that was right for them. And also people told us, you know, with technology and digital capabilities, which we particularly heard during COVID, that they felt that there was a lot more that we could do. So people were looking, you know, might be booking insurance services, and they go online and there's a little chat box in the corner and you can speak to somebody directly. They're thinking, if I can buy insurance that way, why can't I go online, find information? But then if I just want a conversation, why can't I do that? Why isn't there a telephone number? So it really just made sense hearing all of this, and also having this investment. We get those services right for people.
Thank you.
Okay. Do you want to?
Go on there, Vijay bhai.
Okay. આજે consultation જે છે શું કરવાના છે કે એક જ નંબર આવશે બધા સારું કે જેને ફોન કરવું હોય ને બધાને મોકો આપવાના છે કે તમને શું જોઈતું છે અને કેવું આપણું સર્વિસ જોઈ છે તમને લોકોને. Yeah?
Great.
Is that right?
That's right. Well, we've got Mita. Just Mita, you've heard what Sue said in terms of why the consultation is taking place and also what plans for what they hope to achieve. Obviously, from a carer's point of view who's trying to access services, are you happy to share what you'd like to see in the future to help carers access services? And if you're okay, are you happy to speak in Gujarati and English as well, if that's okay?
Yeah, I'll try.
Okay, thank you.
Okay. એ તકલીફ શું પડે કે છે ને તે જે વ્યક્તિને જે બીમારી હોય એ કબૂલ નહીં કરી શકે કે એમને ખ્યાલ નહીં હોય કે એ બીમાર છે તો મદદ ગોતવાની બહુ તકલીફ પડે મા કે બાપ કે બેન કે ભાઈઓને તો સર્વિસીસ મદદ કરતી શકતી હોય તો એ ઘણું સારું વસ્તુ છે પણ એવી મદદ મળે નહીં કારણ કે એવી સર્વિસ અત્યાર સુધીમાં મને નથી અનુભવ થયો છે.
Thank you, Mita. I think basically, Sue, what Mita's saying is really that it goes to the point you raised about services being closer to home and in the community. And I think it's the challenges and the barriers of the communities not knowing what is available. And again, it seems to be a lack of engagement as well from some of the services. So I think that's hopefully will be a future consultation to take back. And I'm going to just let Dinesh Bhai just explain in Hindi as well.
अच्छा, अभी हमने सू और मिता को सुना कि इस विचार विमर्श इस कंसल्टेशन से हम क्या परिवर्तन चाहते हैं और उसी के बारे में सू ने कहा कि इसके बारे में जब शुरुआत में बातें की गई, विचार विमर्श किया गया, उसमें एक महत्वपूर्ण बिंदु निकल कर आया कि लोगों को संपर्क के लिए कोई एक संपर्क का स्थान चाहिए ताकि बहुत ही शीघ्रता से और सहजता से संपर्क किया जाए और लोग क्या है कि एक ही जगह सभी को जाने की सुविधा नहीं होती, इसलिए लोग ये चाहते हैं कि ये जो सेवाएं है उनको वे जहाँ रह रहे हैं वही वातावरण में उनके आसपास मिले या उनके घर मिले। तो इसके बारे में मिता जी ने पण कहा कि जब मानसिक अस्वास्थ्य की समस्या होती है तब कहाँ जाए, किनके पास जाए, वह लोगों को समझ में नहीं आता है.
Sarah, just I want to bring you in as well, just from your kind of what you've heard from Mita and also from your clinical role in terms of what do you see as the key needs of what could be improved for future services.
I think having done a couple of these consultations, I think there's a consistent theme of what's just been said about where do loved ones go to get support for their family members who might lack insight. So I do think there's a lot of work that needs to be done with these communities in terms of awareness about mental health services, where we can take our loved ones when we need support, that early intervention, which I know there's a huge focus on. So we are listening and we are taking that on board.
Thank you. That's some really good points that you've raised there. I'm going to bring Vijay to ask the final question and then we can obviously look at where you can go for further support and information to help you feeding the consultation. And there'll be a number of organisations. Certainly we're working from South Asian Health. We're working with the NHS as well. EAVA FM are working with the NHS to make sure our communities get their voices heard and that will help to shape future services. So I'm just going to bring Vijay in now. Vijay, bye.
Okay. So Sue and Zara, what do you want people to really do? And how can people find out more about this proposal? What is the main objective of the consultation? Yes, we want people to fill it out, but also, and And how can they find out all the information they need? Because I know lots been proposed. So how can people find out, Sue?
So for me, a lot of people ask us, why are you asking for information from us about how we want services? And I suppose I align it with everything else in our day-to-day life. So, for example, if we're buying a Hoover, a vacuum cleaner, that manufacturer of vacuum cleaner will have found out what people want. If people said, I've got a dog, I need to get the dog hairs up easily, I've got some stairs, so I need a nozzle to get on the stairs, or I don't want to be followed around by a lead, so I want it to be easy in that respect. So a huge amount of information goes into from service users to a vacuum cleaner, and we should be doing that with mental and physical health. The best services are designed by service users, patients, by staff, and by carers. Those are the ways that the best services are provided, because it's really done in a sort of co-designed way. So that's why we're asking people to participate, because we don't know whether we've got it right. Some of these things were introduced during COVID. So they were done quite quickly. So we need to know, did we get it right? Do we need to tweak them? Do you still want these services? And then there are a whole range of others that, we haven't had a chance to talk about today, but, perinatal, maternity services, dementia care, those services, if people sadly go into the judicial service rather than into mental health support. So there's a whole range of services, and we need to get it right. So that's why we're asking people to get involved. Tell us what is right for you. It's great to hear from carers, from younger people who might be using adult services in the future. So we need to hear from everybody. And the way people can get involved is that they can go online. There's a lot of information in various languages online and in various formats. Or they can call us and they can get a paper-based survey, and they can fill that in the comfort of their own homes. If they don't want to fill out a survey direct, they can actually call us, and we can arrange to talk to them over the phone and fill in that survey on their behalf, make sure that is input. But we also have a number of events still, because we don't close this consultation until the 15th of August. So we can also invite people, and they can come along to events to, again, discuss what matters most to them. So there are lots of opportunities, but we would just say to people, get involved, tell us how it is for you and your community, so that we get this right.
Okay, thank you. I'm just going to say this a little. I'm going to briefly translate this in Gujarati. Okay. જે સુએ વાત કરી છે કે બધાને શું કરવા એ લોકોને ઇન્ફોર્મેશન જોઈતું છે કે આ જે પૈસા એ લોકો વાપરવાના છે નવા સર્વિસમાં, તે આપણને એ લોકોને સંભળવું છે કે તમને શું કરવું છે, કયા સર્વિસ તમને જોઈતા છે, કેવી ના કરવું છે આ મેન્ટલ હેલ્થનું સર્વિસ આપણે કરવાના છે, અને પછી આપણને બી મોકો મળતો છે કે આપણને શું જોઈતું છે. એટલે એ બહુ ઇમ્પોર્ટન્ટ છે કે આપણે બધા આ લોકો NHS ને કહી છે કે આપણને શું જોઈતું છે, કેવી ના કરવું છે, ને આપણને વધારે ઇન્ફોર્મેશન જોઈતી હોય તો આપણે છે ને ઇન્ટરનેટ પર જજો, વેબસાઇટ પર જજો, ને ટ્વિટર, ઇન્સ્ટાગ્રામ, ટ્વિટર પર બી જજો, ફેસબુક પર બી જજો, ને પ્રશ્ન પૂછજો કે આપણને શું જોઈતું છે, કેવી ના જોઈતું છે. Is that right?
ને અમે છે શોમાં પછી તમને ફોન નંબર બી આપશું કે તમારાથી ફોન બી કરાય. જો તમારાથી જો ભરવું નહીં હોય ફોર્મ, તો તમારાથી ફોન કરાય, તો એ લોકો તમારા સાથે વાત કરશે ને એ લોકો ભરશે તમારા માટે. ને મેઇન ઇમ્પોર્ટન્ટ છે કે આપણે છે ને સાથે કામ કરવું જોઈએ NHS સાથે. એ લોકો એકલું નહીં કરવું જોઈએ. આપણે સાથે પેશન્ટ તરીકે, નહીં તો કમ્યુનિટી, નહીં તો કેર તરીકે આપણે સર્વિસીસ સાથે ફ્યુચરમાં બનાવવા જોઈએ.
હા, એ બહુ ઇમ્પોર્ટન્ટ છે. કે બધા સાથે આપણે કામ કરે તો એ લોકોને બી ખબર પડે કે આપણને શું જોઈતું છે. આપણી જે કમ્યુનિટી છે, આપણા જે ગુજરાતી કમ્યુનિટી છે, એ લોકોને ખબર પડે કે આપણે કેવી રીતના કામ કરે આપણી કમ્યુનિટીમાં, અને એ લોકોને બી સમજ પડે કે આપણું કલ્ચર બી થોડું સમજ પડે કે આપણને શું થતું છે. આ જે બીમારી આવે છે, મનમાં બીમારી આવે છે, તે આપણે બહુ બોલતા નથી, એટલે આપણે બોલવું જોઈએ કે આપણને શું બીમારી છે ને કેવી ના છે, અને આ બીમારીમાં એમાં શું ઇમ્પોર્ટન્ટ છે કે આપણે બોલતા જ નથી. એટલે આ વખતે આપણને મોકો મળેલો છે કે આપણે બોલે, એમાં કઈ પ્રોબ્લેમો નથી કે આપણે બોલે છે.
માનસિકની બીમારી છે, આપણે કમ્યુનિટીમાં આપણે વાત નથી કરતા, એટલે એમાં વધારે જરૂર છે કે જો આપણે વાત કરીએ તો કઈ રસ્તો તો છે. ને આપણા પુરુષ લોકોને, ખાસ પુરુષ લોકોને, માણસ લોકોને આપણે અંદર બધું રાખે, એટલે આપણે છે ને બહુ વાત કરવાની જરૂર છે કે આપણે તો સપોર્ટ મળે. દિનેશભાઈ, તમે થોડુંક હિન્દીમાં તમે समझाओ.
ओके, अभी विजय जी ने सवाल पूछा सुको कि लोग इस प्रस्ताव के बारे में कैसे ज़्यादा जानकारी पा सके, तो उसके बारे में सुने बहुत ही अच्छी तरह बताया कि आप जो भी कुछ फ्रिज या वैक्यूम क्लीनर जो भी इस्तेमाल करते हैं, वो जो भी बना रहे वे इनको उपयोग करने वाले लोगों से ये जानकारी पाते हैं कि क्या करने से वो उनके लिए ज़्यादा अच्छा हो. तो इसी के लिए यही यह विचार विमर्श का जो लक्ष्य है कि जो मानसिक स्वास्थ्य की सेवा जो इस्तेमाल करने वाले लोग हैं, उनके कैरियर है, उनके साथ जो स्टाफ है, उनके पास जानकारी लेकर ये सेवा ज़्यादा अच्छी बना सके. और इसके लिए आपके लिए एक सर्वे का फॉर्म है जो गुजराती, हिंदी, अन्य भाषा में भी है. अगर मान लीजिए आप सर्वे का फॉर्म नहीं भर सके तो आप मोबाइल फ़ोन या फ़ोन पर आप उनसे बात भी कर सकते हैं. NHS काफ़ी इवेंट भी आसपास आपके कुछ इवेंट्स रख रहे हैं, तो आप वहां जाकर उनसे बात कर सकते हैं. तो इस तरह से आप ये सर्वे में ये जो NHS को जो ये जानकारी चाहिए उसमें आपकी भागीदारी, और वो बहुत ही महत्वपूर्ण है कि आपके मन में जो भी है वो आप उन्हें बताएं. आप अगर नहीं बताएंगे तो सेवाएं अच्छी नहीं हो सकती. आपके विचार बहुत ही महत्वपूर्ण हैं.
Meeta, have we still got with Meeta with us, just to give her the last say before she? Yes, great, thank you, Meeta. Just as you've got to leave shortly, any final comments that you'd like to make in terms of that will help NHS listen to the carers' views, particularly, but also from the community?
I think there are a number of different levels of care and support. So that low level of community support where people can have a chat, maybe talk to somebody, that's great. I think what I've encountered is that I need that support as a carer for a person who doesn't have insight. So I don't have to wait until he or she gets really bad, gets to a crisis point before I can do something or some service to help support me. So I think that there is something about different levels of need and catering to that. So we don't have to wait. And now it's costing the NHS a lot of money treating him. And if I'd had some level of support or care early on, it would have really helped prevent my son going through what he's had to go through and what I've had to go through, which has been absolute hell.
Thank you, Meeta. I think it's really good to hear your suggestions for future, and it's really important that we have to work with the NHS to make sure they get the services right in the future, and that's what this consultation is about. And there's a number of events taking place, so look on the NHS website, and there is a carers workshop later today from 10:30 till 12. But also there is going to be a specific Asian Gujarati presentation on this consultation on next Thursday, the 29th at 7 p.m. So again, we'll share the information about that. Dinesh Bhai, just a quick recap on what Meeta's saying in terms of what she'd like to see.
Before you just say, I just want to talk a little bit more about this event that we've got going on. The event is taking place on today, 22nd, at 10:30 till 12. It's the carers workshop. It's there. It's a Zoom event, so if anyone wants to join in, please join in. Absolutely, it'll be great if people join in if you want more information. Ajay Sarada se આપણું ઉદ્ઘાટન થવાનું છે ઝૂમમાં. તમે જોઈન કરજો, જરૂર જોઈન કરજો. વિડીયોમાં તમને બધું સમાચાર મળશે. આખું પ્રપોઝલમાં સમાચાર મળશે. આ ઉદ્ઘાટન કરવાના છે તે આ પ્રપોઝલનું, એટલે તમે જોજો. સરા 10 આવવાનું છે. હમણાં વેબસાઇટ પર તમે જોજો, બધા ડિટેલ્સ છે હમણાં. Is that okay?
Now the ગુરુવારે બી આપણો Asian women, Gujarati women માટે consultation નું ગુજરાતીમાં presentation કરવાના છે. એ બી Zoom ઉપર છે next Thursday 29th તારીખે 7 વાગે. એ બી અમે તમને information આપશું.
તમે hosting કરવાના છે?
અમે host કરવાના છે South Asian Health સાથે.
South Asian Health, એટલે એ બી તમે જરૂર કરજો. કિરીટ ભાઈને મેસેજ મોકલજો, નહીં તો આપણા EAVA FM માં તમે મેસેજ કરજો. તમે ફોન કરતા છે, ફોન કર્યા કરજો. જે તમને જોઈતું હોય તે બધું મળશે તમને. બધા લિસનરને ખબર છે કે તમે જ્યારે ફોન કરે છે, આપણા પ્રેઝેન્ટર તમને સાથે બહુ વાત કરશે. આપણા ફોન બહુ આવતા છે, એટલે તમે ફોન કર્યા રાખો. સવારે બી બહુ ફોન આવે છે. તમે દિનેશભાઈને ફોન કરે, નહીં તો વીનાને ફોન કરે, અશોકભાઈને ફોન કરે, રૂપાને ફોન કરે છે. આપણા બધા પ્રેઝેન્ટર જે છે તમે ફોન કરે છે, તમે ફોન કર્યા કરો. આપણે કોઈ દિવસ ના નહીં પાડશું ને કઈ પ્રોબ્લેમ હોય તમને આપણે બધાને કહેશું કે કેવી ના કરશું. દિનેશભાઈ, તમને જે વાત કરવી હોય, આપણે 9 વાગે બંધ કરવાના છે આપણું લાઈવ, એટલે આપણી પાસે 2 મિનિટ છે.
अच्छा जी, मिता जी ने अपना कैरियर के नाते एक अनुभव हमारे सामने पेश किया कि एक कैरियर के नाते भी उनको सपोर्ट की, सहायता की जरूरत होती है, और वो बहुत ही महत्वपूर्ण है. ताकि कैरियर को इसके बारे में हो सकता है कि जो मानसिक स्वास्थ्य की समस्या है उसके बारे में क्या किया जाए, कैसे किया जाए, वो उसी समय उनको मालूम नहीं पड़े. पर अगर उनको सहायता मिल सके, सपोर्ट मिल सके, तो एक कैरियर के नाते अच्छी सेवा प्रदान कर सकते हैं.
Thank you. So we're going to end this show at 9 a.m. So in 2 minutes. So really want to thank Sue Venables from the NHS, also to Zara from NHS as well, and thanks to Meeta for joining us as well to share her experiences, and really urge our communities to come forward, give the feedback, and let's shape the services for the future that's going to be more sensitive to our community needs and cultural needs. આપણે નવ વાગે બસ બંધ કરવાનું છે આ શો. થેન્ક યુ. આપણા જે આવ્યા છે આજે NHS માંથી સુ, ઝારા ને મીતાબેન કમ્યુનિટીમાંથી આવી છે, કે ને આપણે જો આપણા કમ્યુનિટી તો આ કોન્સલ્ટેશનમાં નહીં આપણે સપોર્ટ કરે તો આપણા ફ્યુચરમાં જે સર્વિસીસ જરૂર હોય તો નહીં થશે. એટલે આપણે જરૂર તમે સપોર્ટ કરજો ને અમે EAVA FM સાથે કામ કરજો ને જે બધા કમ્યુનિટીમાં કામ કરજો ને સપોર્ટ આપજો. Thank you. Dhanyawad.
Okay. Just want to say thank you to all our guests today. That's fine. Yes, absolutely. It's been fantastic having everyone here, and I think it's really important that we discuss anything around mental health within our communities, especially try to translate in different languages as well. You know, it's really so much needed in our community. So if anyone out there can even pass on the message, apre joi koine male che apri community ma bare male ke under male ke apro dosta hoy ke apro kutumb ma hoy, બધા સાથે વાત કરો કે આ mental health ની issue જે હોય, આ બીમારી હોય, મનની બીમારી છે, એટલે બધા સાથે વાત કરજો. આ EAVA FM છે. આપણું શો carry on થશે FM માં 102.5. હમણાં આપણે ફેસબુક ને આપણે યુટ્યુબ બંધ કરવાના છે. આપણે બધાને મળશું ને તમે થેન્ક યુ બધાના મેસેજ આવેલા છે ને ચાલો બાય.
EAVA. Share